Well, welcome everyone. My name is Todd Sack. I want to welcome you this afternoon if you're on the West Coast, this evening if you're anywhere else, or on the East Coast. Thank you for attending this workshop, and my particular thanks to the consortium for inviting me, and to the marvelous staff. We're helped tonight by Savannah Martinsik as moderator, who will be monitoring the chat. So if you have questions, please load them into the chat, because we'll hope to leave about 15 questions for getting going. Beverly Harp will be our co-moderator. Colin Nackerman and Wendy Cook also helped me a great deal. I want to thank all of them for supporting me in this. So this is going to be a workshop, so we're going to put you to work. Let me start by saying a bit about me. Next slide, please. Thank you, Savannah. I'm a gastroenterologist in Jacksonville, Florida, and I've been around the sort of environmental and medical organizations world for quite a while. As president of my county medical society, I chaired my community environmental protection board, which I encourage all of you to do if the community has such a board, because health professional leadership is so important. I served on the Florida Energy Commission, where I chaired their climate change advisory group. I chaired the environmental health section for the Florida Medical Association for 10 years. I'm here today wearing a bunch of hats. One is executive director of the Migraine Doctor Foundation, and as treasurer of Physicians for Social Responsibility, and I have no financial disclosures today. But we've talked about me. I want to now talk about you. So I'd like you to, if you're on the West Coast, with your first glass of wine, hold it up. And with the second glass of wine, with your second hand, I'd like to raise your hand if you work in a healthcare office in any way. Just raise your hand. Very good. And please leave your hands up while I ask again. Raise your hand if you have any administrative role in an outpatient healthcare office. Very good. Keep those hands up. Now I'd like to raise your hand if you know anybody who works in the healthcare office. Good. And with that, we probably have everyone with, I hope, a glass of wine in your left hand and your right hand raised. Lower your arm. That's going to be the greatest work you're going to do in this workshop. But the point is that we all have some role with an outpatient healthcare office. And what I'd like to do tonight is to inspire you to take one action to make a change in how we practice health outpatient medicine. Let's go to the next slide, please. I represent the Migraine Doctor Foundation, which is an organization that provides climate change teaching for patients and health professionals of historically disadvantaged communities. We have access to thousands of waiting rooms around the world with brochures, posters, handouts, PowerPoints, and more in both English and Spanish. We actually have two websites, migrainedoctor.org and migrainedoctor.es for our Spanish-speaking colleagues, and we're proud to be a consortium affiliate organization. If you would like access to brochures for your waiting rooms, let's talk. Next slide. And I'm also proud to be a part of Physicians for Social Responsibility, which I know many of you are members of and work with closely, a charitable nonprofit since 1961, shared in the Nobel Peace Prize in both 1985 and 2017, with health professionals in 20 state chapters, addressing the existential threats to mankind, nuclear war, and climate change. And the website, pso.org, is a wonderful resource for nuclear war and climate change, with lots of teaching materials, PowerPoints, etc. Next slide. So I want to talk about four things why healthcare practices are important. And when I say practice, I mean any outpatient setting where healthcare occurs, whether it's an office, a clinic, an imaging center, a diagnostic location, anywhere in the world. What are resources available for practices? What solutions are available for hospitals? I'm going to talk about the Migraine Doctor Service, and we'll talk about getting you started today. Next slide. So I'm in Florida, and I just want to remind you why this is also important. Last year, the world reached 450 parts per million carbon dioxide, and I used this slide to highlight what the world looked like last, at least my world, Florida, in the middle Miocene era, 18 million years ago, when carbon dioxide was last in the 415 parts per million range. What you see is that the glaciers melted, the ice caps melted, and Florida was largely underwater. Many of us fear that this is the scenario already baked into our world by over 450 only 415 parts per million carbon dioxide. And that if we don't radically reverse this, this is what we face somewhere in the next century. A devastating, devastating possibility for the world. Next slide. But we don't have to wait 100 years. This is my town, Jacksonville, Florida, suffering from Hurricane Irma in September 2017, where thousands of middle class and poor people had their homes flooded. This is, of course, a devastating financial loss, but even more worrisome are the health consequences of this devastation. And we just can't have this keep going on and on in our communities. Next slide. Remember, too, that climate change will be the world's #1 health and public health challenge by 2050, if not sooner. Next slide. And also be reminded of the words from a former president of the American Medical Association, Dr. Hovind, who told us that environmental health determines 40% of the health outcomes for populations, compared to just 10% impact for the traditional work of physicians, nurses, and other health professionals. So if we're not talking about environmental health, and by that we mean primarily climate change, and looking for solutions from within our profession, if we're not doing that, we're missing far greater opportunities to improve health outcomes than simply monitoring blood pressures and checking blood sugars for our patients. Next slide. So let's now turn to why healthcare offices are important. Of course, there are millions of medical offices worldwide. The EPA tells us that offices can actually cause illness, that the inside air is dirtier usually than the air outside. And this is due to the presence of chemicals, particulates, fungi, and other contaminants. Also, as health professionals, we use significant resources, electricity, water, paper, chemicals, and foods as well. Our offices tend to be high cost and inefficient. And as I'm going to remind you in a few minutes, 28% of healthcare's greenhouse gases come from outpatient medicine. So our outpatient world plays a substantial role in the healthcare industry's greenhouse gases. And finally, I'd like to always remind everyone that healthcare offices can be valuable sites for education and change on the topics of environmental health and climate. Next slide. So this is to talk briefly about healthcare's energy intensity. Energy intensity is an engineer's measurement of how much energy is used per square foot. And you can see the healthcare is right up there as #2, right after food services. Next slide. Looking more closely at healthcare's greenhouse gas intensity, this is a slide I prepared from the pioneering work by Eckelmann and Sherman. Jody Sherman is a participant in consortium events. She's a pathologist at Yale. And their analysis in PLOS One in 2016 tells us that healthcare is responsible for 10% of US greenhouse gases, 10%, a substantial amount. Also 10% of smog forming, disease causing air pollution, and 1 to 2% of carcinogenic and non-carcinogenic air toxins, the HAPs, HAPS molecules. Only one third of healthcare's greenhouse gases are caused by hospitals. Outpatient care has nearly the same greenhouse gas and pollution impact as hospitals. Next slide. On this slide, I've taken Eckelmann and Sherman's data and broken it down by sectors within the healthcare industry. And you can see that hospitals account for about 36% of greenhouse gases produced by the healthcare industry, outpatient care, 26%, retirement and nursing homes, 6%, our use of prescriptions, 10% of healthcare's greenhouse gases. So as you prescribe something, you're responsible for greenhouse gases. Other services, and then construction and manufacturing. When we build these monstrous healthcare facilities, the construction itself is part of the global warming problem. Next slide. But I also want to talk about we health professionals as role models. This is a survey from the Gallup Group 2017 that with about the same results every time it's done, asking Americans which professions are trusted most. And at the top of the list are nurses, followed by military officers and grade school teachers, and then quickly by medical doctors and pharmacists. So we health professionals play a very strong role in influencing our colleagues and our patients and our communities. And why not take advantage of that to talk to our patients about public health measures that can affect their own home's bottom line, because they can save money as they save energy, but particularly improve the health of the community as they're using less energy, fewer chemicals, better use of water, healthier foods, transportation, and the like. But this isn't just a selfish argument on our part. This is because we care about our community health, and we care about the health of the patients you're talking to. Next slide. So, in summary, healthcare practices are important because climate change and environmental health are important for the health of our patients, because the practices themselves have a significant effect upon the environment and the climate, and because as we as role models and teachers in the communities, health professionals, we can be important community change agents. Important community change agents. Next slide. Okay, what resources are available? Next slide. I want to direct you to a number of free resources available online to help health professionals in their offices go green. MyGreenDoctor.org is one I'm very fond of since I edit it. I think it's the easiest to use, but it's not the only one. PSR, Physician for Social Responsibility, has lots of great resources. I love the American College of Physicians online toolkit. They have wonderful posters and handouts that you can give to your patients. I love the Green Impact website from the United Kingdom, from the Royal Society of General Practitioners. They have a marvelous website for actually scoring how you manage your office. It's free to use. You don't have to be a member of the Royal Society. I love the consortium's resources. Probably the most detailed resources for greening healthcare are on the Medical Society's website, all free. And the American Academy of Pediatrics has a wonderful website as well, their Global Warming Children's Index page. So these are free resources you can go to. I'm going to spend a couple minutes talking about My Green Doctor, but I want to highlight that all of these are useful, and you'll find that they all refer to each other because everyone recognizes we can't do this alone. Next slide. Next slide, please. We'll talk about hospitals for a moment. My talk is not primarily about hospitals, but remember we talked that hospitals are responsible for 38% of healthcare's greenhouse gases, and I'm a huge fan of Healthcare Without Harm, the pioneering world leader in environmental sustainability for hospitals and health systems. They talk about greening operating rooms, sustainable and healthy foods for hospitals, green procurement processes, guidance for hospitals on medical waste management, use of chemicals and toxins. They are very strong advocates worldwide for climate action, and particularly one of the earliest healthcare groups to talk seriously about environmental health and environmental justice. Their website, noharm.org, I recommend. And if you don't yourself work in an office, but you work primarily in a hospital, be sure your hospital belongs to Healthcare Without Harm, and be sure that they're sending administrators or yourself to their annual meeting. It's a clean that it's called. It's a great meeting, and bring home wonderful money-saving and health-saving ideas for your healthcare system. Next slide. Okay, let's talk for a couple of minutes about the My Green Doctor service. This is where I try to get you excited to get going in your own practice or clinic. Next slide. So My Green Doctor is an online environmental sustainability practice management program. There's two sites to access it, mygreendoctor.org or mygreendoctor.es for Spanish. I hope you'll register tonight if you haven't. It's used by thousands of health professionals now in 43 states and 80 countries. Our monthly newsletter goes to about 220,000 healthcare professionals. 12 organizations provide My Green Doctor to their members as a free membership benefit. And for those 12 organizations, this service is free to the organization and free to their members. And since their members each will save about $1,500 a year by using My Green Doctor plus other benefits, there's really no reason not to offer this to your members. So if you are a leader in a healthcare organization, please reach out to me. Let's sign up your organization and have them offer My Green Doctor or one of the other resources to their members to encourage them to get on board with sustainability and climate change preparedness. My Green Doctor is for any type of outpatient healthcare office or facility. It's easy to use, fully scripted. I mean, fully scripted and free. There's nothing for the office manager or yourself to even study. It's comprehensive, science-based, written by peers. and non-political. And as I may have mentioned, most offices using My Green Doctor save money in the first month. Next slide. These are our partner and participating organizations, some small, some large, but all offering this to their members: World Medical Association, the Consortium, the Florida Medical Association that developed My Green Doctor, the American Academy of Family Physicians, the American Academy of Dermatology, and many, many others. And I'm very proud that these organizations have placed a in My Green Doctor by offering it to their members. Next slide. When you go to the website, you see immediately that My Green Doctor saves you money by showing your office how to adopt wise environmental practices. Often it's the hook of saving money. It's the hook of saving. And you hit the register button. It takes about 80 seconds to register, and it's free. No password is required. So if you haven't registered, please get on board. Next slide. When you're office registered, you get a free pledge certificate that we encourage offices to print 2 color copies, buy simple frames, and put one in their waiting room and one in the break room, the lunchroom, to proudly tell everyone that you pledge to go green. And it's available now in 8 languages, and we can prepare it really in any language you'd like. This is Spanish and English. Next slide. How is the service used? First, we urge managers to commit to environmental sustainability as a goal, as a core value for your practice, for your clinic. You know, many offices do a few things. Maybe we recycle, or maybe we turn off some of the light switches at night. But doing 1 or 2 projects isn't a sustainability system that it's going to make a difference for our world. So managers should commit to environmental sustainability in a complex and comprehensive way for their organization. Then managers and any health professional can register at the website and go ahead and display that My Green Doctor Pledge certificate to tell the world proudly that this office is going green, and get some credit for it from a public relations standpoint. And then plan to add 5 minutes of green team business to each regular practice management meeting. You know, 10 years ago, My Green Doctor recommended offices to have a whole hour for lunch once a month to do green team business. Nobody has time for that these days. But when we flipped it to 5-minute meetings, 5 minutes added to your regular practice management meeting, 2 things happened. First, everybody in the practice was there. So it wasn't just a small group of maybe outliers who cared about going green. The whole office is there to participate. And because it's only 5 minutes, people can do this. I had an office from Denver this week complete our program and get our Green Doctor certificate, and one from Greece. It's starting to pick up that people can do this. You use our meeting by meeting guide. The meeting by meeting guide provides a clear script for every meeting. So there's nothing for the office manager or for you to study or prepare. And you're going to do sustainability in small bites, just a few steps, 1 or 2 at each of your monthly management meetings. And over a period of months, you suddenly have a comprehensive sustainability program for your practice. And as I said, most offices save money in the first month, and after about 5 months, you qualify for a very handsome Green Doctor office certificate for your waiting room and your break room. Next slide. I think I've mentioned this already pretty well, that the meeting by meeting guide explains exactly what to say and do. There's nothing to prepare, and we focus on small, steady improvements. Patient and staff education are emphasized as an important part of going green. And we encourage staff and practice discussion. We provide a green team notes form that makes it very easy to keep records and send them to us when you're ready for your certificate. Next slide. I'm not going to go in detail through the website, but I'm going to show you some of the topics that we talk about. We ask officers to learn about their carbon footprint. We give them tools to do that and to talk about it within the practice, to save energy in various ways, to look at their use of chemicals, particularly cleaning products, carefully. And I'm a fan of the Safer Choice options, which has more than 4,000 products certified by the US EPA as being safer in their manufacturing, safer for your office, and safer after use for disposal. We encourage offices to recycle, to get rid of styrofoam, and to do purchasing responsibly, to choose healthy foods for the office, healthy for those working in the office and healthy for the environment. In the upper right, you see an example of one of our posters. This poster actually we bought from somewhere else, maybe from the ACP, I forget. But we have more than 24 brochures, posters, and other teaching materials in English, and many of them now in Spanish, that you can print and give to your patients. And we have a program now where we're going to be mailing free brochures to offices. So if you're interested in receiving free brochures and a display holder for your waiting room, let me know. We'd be delighted to include you in that program. And finally, offices get the Green Doctor Office Pledge Certificate when they register. Next slide. I think I've talked about patient education. One I didn't talk about is our Tip of the Month program. We have a Tip of the Month program where an office can adopt one theme for the whole month. And everyone in the practice will say a word or two to everyone who walks in the office. Maybe it's about energy or recycling or disposing of pharmaceuticals, or, well, we give more than 30 different topics to cover more than 2 years of Tip of the Month. We have blog essays. We have a sustainability policy for management. So as part of going green as a practice, as a core value of a policy that an office can adopt. We have a quality improvement curriculum for medical students and free education courses for professionals. Next slide. I'm going to give you 2 success stories. First, the Escambia County Health Department in Pensacola, Florida, that began saving money and energy. The first month they used My Green Doctor, they saved 5% energy in the first year, which was 120,000 kilowatt hours of electricity, represented 85,000 metric tons less carbon dioxide from this one practice, the equivalent of 9,500 gallons of gasoline that didn't have to be burned. They've been saving, well, they started $14,000 the first year. They're doing more than that now. In 2018, they put solar panels on one of their buildings with the money they'd saved. And you can see the solar panels under construction. And of course, once they put solar panels on, they're saving even more. This office is probably almost off the grid. Next slide. This is our latest, almost latest, or one after this, but almost our latest success story, the Westwood Clinic in Denver, Colorado, a practice that came to us through the American Academy of Family Physicians partnership with us. This is a family medicine practice with more than 30 employees. In their Green Team notes, they told us that they've had Green Team meetings beginning in October 2019 through 2021. They've embarked on many, many energy management steps, comprehensive recycling, including of batteries and electronic devices. They switched away from disposable products to generally reusable products. They have undergone many education projects, mostly for the staff, not so many for the patients yet. And they were one of the first groups to use our Tip of the Week program for the staff. So hats off to Westwood Clinic. Westwood Clinic, like Pensacola, the Pensacola Public Health Group gave us permission to tout their great work. Next slide. Okay, getting started today. First, ask your professional society to offer My Green Doctor as a free, money-saving, and climate-saving membership benefit. It's truly free. We don't charge your medical society a penny, and nor do we charge your members. Hint, email me today to learn how. This is something great you can do for your peers. Will your society embrace this? You know, a minority of your members will at first. Typically, under 5% of members embrace it in the first year, but over time, more and more will. Register today yourself if you haven't registered at My Green Doctor. Make environmental sustainability and climate change preparedness a core value of your own healthcare practice. If you're in charge, get a group of your colleagues together. If you're not, talk to those in charge and go in that direction. I plan to add 5 minutes of My Green Doctor at each practice planning meeting, and pledge as a group, as an organization, to earn the Green Doctor Office Registration Recognition Certificate, which is free to you if your organization is a partner or a participant in My Green Doctor. It's $250 if your organization is not participating in the My Green Doctor service. Next slide. Okay, we talked about how healthcare practices are important, that healthcare in general is 10% of the United States greenhouse gases, and that outpatient medicine, healthcare practice is about 28% of healthcare's greenhouse gases, that there are extensive resources online for practices, and I encourage you to use those creatively. We talked about Healthcare Without Harm, the marvelous organization that supports hospitals and large medical centers. We talked in detail about the Migraine Doctor Service, which will save you money and have many other benefits. In fact, look at our page called 10 Reasons to Go Green. If that doesn't make you want to go green, nothing will. And how to get started today. Okay, today is where I ask you to do something today. If you haven't registered Migraine Doctor, please do. If you haven't asked your professional organization to itself embrace sustainability, enter a policy at your next annual meeting to have your organization pledge to sustainability. I've been successful with dozens of these, so if you need a template policy, give me a call. But if your organization has already pledged to go green and they're not offering a service like Migraine Doctor to their members, ask them to do so. This is how an organization implements their policy to have their organization, to have their profession, their subspecialty go green. Getting started today then is either you're self-registering, it's working towards getting your organization registered, or if your own practice doesn't have already a sustainability program, talk to your office manager and just get started. It's really very easy. Next slide. Okay, this is Greening Your Medical Practice, a practical guide. I want to thank you for going green, for doing your share to avert climate change. And I think we have time for questions from the chat. Savannah and Beverly, we have any questions?
So yes, folks, drop some questions in the chat. We did have, actually, it seems like more of a discussion point with the audience, which is, who here is aware of or involved in an existing sustainability committee at their clinics, hospitals, academic health centers, or health systems. So trying to gauge, I think, who participating is involved in that. So maybe also dropping responses to that in the chat.
Beverly, why don't we turn off screen share? Great. David Pollock, you asked that question, a psychiatrist on the West Coast.
Yes, I did.
Well,
I think it's really important, and I'll just give an example. I'm retired, but I'm an emeritus faculty member at Oregon Health and Science University in Portland, and for the last 3 years, I've been serving on the sustainability steering committee that the university has, and we have been seeing lots and lots of progress as a result. Our hospital and health system contracts with Healthcare Without Harm through their Practice Green Health subsidiary to work on replacing fossil fuel-based tubing and foam and other kinds of materials that are used in hospitals and procedural settings. The construction and the heating and all of the different elements of the system are participants in the sustainability committee. I've been primarily focused on curriculum development, and I'm really excited about what we've done on that, but I'm not going to take time to talk about that today. I just think if it's not happening in your setting, it's something you can ask about and stimulate folks to be answering the question about, well, if we don't have one, why not?
Yeah. Is there anyone who works in a clinic who would like to comment on their own experience, whether they have a environmental program, sustainability program or not? And if so, how's it going? If not, why not?
We got in the chat a few more questions if no one wants to come forth with their clinic example. So we have a question from Molly, which is, if you're a member of a large healthcare organization, can you join as a single individual?
Well, Migraine Doctor is open to any human being on the planet. We have lots of non-healthcare professionals who use it. There's really no joining. You just register and open the website and then use it. So we have lots of nurses and administrators and physicians and some attorneys and others who registered at the site. So anybody can use the site, and I encourage everyone to access it to get ideas.
Great.
It's free and safe.
So we have another question here from Joanne. If you could please share some initial steps that a medium or large multi-site system might make, especially as many of their sites are rented properties.
It's a very good question. The low-lying fruit is always energy, and often if you rent a property, you don't have a lot of control over energy use because you can't control the thermostat. But let's start with the first step. The first step as an institution, whether you're one office or several offices or a whole network, is to pledge to go green, to make sustainability a core value of your institution. And it's very doable. It can be done in two ways. One is to just go straight to the top, go to the head of management for the whole system or a president and inspire them to create sustainability as a core value. Or the other is to work in your own clinic and speak to your clinic manager and say, we're going to try Migraine Doctor, or we're going to try the ACP's program, or we're going to try the Royal College of General Practitioners program. But we as a small group might pledge to go green and to brag about it with that pledge certificate. So the first step is your institution to pledge to go green and to talk about it, to brag about it. The second step is to add small changes at your practice management meeting, whether you use Migraine Doctor, which is so easy, or some other system. At Migraine Doctor, we have more than 120 things you could do, but most groups are too busy to thumb through all those options. So use the Meeting My Meeting guide or some other service and make small steps. Don't get aggressive. Small, steady steps over several months will really make a difference for the climate. Hope that answers your question.
Thanks, Todd. We have a question actually about Migraine Doctor and the structure. So, are there volunteers or interns or staff members besides yourself? How much time do you spend working on this?
Sure.
What's behind the curtain?
I spent about 15 years helping health professional societies develop policies on environmental health. I wrote and passed about 20 of these at the Florida Medical Association, the American Medical Association, and other organizations so that these groups now have substantial policies on physician responsibility for the environment and climate change and coal power plants and urban planning and and medical education and fossil fuel divestment, all these important projects. But I realized after about a decade of this that we were doing nothing to help our members implement these policies. And that's why the Florida Medical Association committee that I was chairing at that time created Migraine Doctor. It gives our members tools that they can use to implement the policies that the organization created. So currently Migraine Doctor is owned by the Florida Medical Association. It's a not-for-profit. We have a separate foundation that supports buying educational materials to give to healthcare offices in disadvantaged communities. Most of Migraine Doctor is me. We've had about 24 volunteers and a couple interns over the past 10 years, but it is mostly me, and it's about 2 hours a week of my time.
Oh, great. Thanks for that look.
So we don't have a marketing budget. Florida can't market this. It's our partners who market it for us. So when you say to the American Academy of Pediatrics, hey, we want you to participate in Migraine Doctor, participating means that you market it for us. You say to your members, we think this is good for you. We think this is going to save you money, and we think it's going to help your patients and help create a healthy environment. And it's going to fulfill AAP's own policies supporting sustainability. So then AAP then markets it using the newsletters and other items that we give them. So that's the nature of partnership. The organizations then market it for us through their normal communication, newsletters and things like that. So when I write a newsletter, I don't send it out. I send it to our partners, and they distribute it to 200,000 healthcare professionals around the world. So join us and help market it for us. And I thank Consortium, because the Consortium is a big part of that marketing process.
Yes, it's very much on our website. If you clicked on anything, eventually you get back to some Migraine Doctor resources. We have a message here about struggling with the issue of recycling and getting, I think maybe there's even a broader question here about, actually getting these policies to be implemented as they're intended. So And I know that's a big question for a lot of people. Does recycling actually happen in our offices and our apartment buildings?
Yeah, the problem in America is most recycling is offered to homes, single homes, and not to apartment buildings or commercial people. What most offices do is they buy the bins. That's pretty easy. Someone has to monitor the bins periodically to make sure things don't end up in the wrong bin. And then usually someone volunteers to take it home at the end of the week, to take home that big bag. And typically it's an energetic, enthusiastic person who agrees to do that, or it becomes a rotated responsibility. That's the toughest one to sustain, but it's the most visible one. When the folks in your waiting room see that you recycle, when the folks in the exam room see you recycle, that's how we influence them to recycle. And you know, is recycling that important? We can debate the environmental benefits of recycling, but it puts in sustainability into people's minds and gets them started. And so we setting an example next hospitals really can change how people in the community look at their world. We can be the role models that spark the spark to make the change.
Great. So seeing if we have any other, I think there's kind of a comment in here about some trouble recruitment, especially with like really significant challenges during the pandemic. And so maybe some best practices about getting people who aren't excited about this, excited about the possibilities.
Yeah, the pandemic was a terrible thing and continues to be in most of the places of the world where Migraine Doctor serves. And we took a break, honestly. We sent out many fewer newsletters last year. People are just too exhausted. And I respect that and respect terrible sacrifices health professionals have gone through. Now it's time to be reminded of how the pandemic pointed out how impaired our public health system was and how ill prepared we are for climate change. And I think that's why sustainability will now become more important in many people's minds. So I think we're ready now in 2021 to start talking about this again. Still has to be easy. That's why we only ask for 5 minutes of each planning meeting. To ask people to do more is not sustainable. We want a sustainable sustainability project. I want to say one other thing. You haven't heard me talk about physicians very much. It's about health professionals. The people who do this work of sustainability are our nurses, our office managers, our clerks, our cleaning personnel, and everyone has to be on the team. Physicians, honestly, we get too busy and we may not pay attention, but there's going to be a couple of leaders in your office or your clinic who will carry the load even when you're not around, when you're tied up in other projects. So let's be a team and let sustainability be led by everybody.
We have time, I think, for this one last question, and then I'll give some closing announcements. And Todd, you're also welcome to give a closing word or two. So this is a question about scalability and translation, and an appreciation for the Spanish language option, and noting that there's 40 to 80 countries that are using this. So, you know, have you connected with the WHO? Are there any similar groups who are adapting this in other countries?
Well, many countries in Europe are ahead of us on this. The UK particularly is ahead of us. But I'm very grateful to the World Medical Association. There was an early partner of Migraine Doctor, Dr. Kloiber, who's been their executive director for many years, encouraged me 10 years ago to push on. And Dr. Kloiber said to me maybe 6, 7 years ago at an AMA meeting, Todd, Migraine Doctor is 10 years ahead of its time. There will be a time when every institution in the world needs to have an environmental sustainability program, and may be required to when the world finally wakes up to the looming catastrophe, environmental and health, of climate change. But no, the World Medical Association has been wonderful. They send our newsletter out to 112 countries every time I come out with a newsletter, and we're going to have offices, many offices, many more overseas using Migraine Doctor than we have in the United States. We're in India and Bangladesh and Sri Lanka and many places in South America, which is why we have the Spanish language version. So World Medical Association has been a great supporter. If I have another moment, I really have to thank the consortium again. I wish I'd thought of the consortium 10 years ago. And what Mona and her team has done is truly spectacular. And so thank you to the Medical Society Consortium, your 37 member associations, your more than 60 affiliate organizations. Thank you for carrying this load as advocates and educators.